Dear students, do you heard the term varicose vein? Yes, it is a new term to you. Varicosity means abnormally swollen. Usually, we find this type of vein as a pathology in the lower limb or lower extremity. And what is this varicose vein and how will you treat it when you will become a vascular surgeon? You can do it only after knowing the anatomy of the venous drainage of the lower limb. Again, there is another term, that is the venesection. It is performed in case of emergency as a very minor operation. So, what is the site of the venesection or which vein is chosen for this purpose? For performing this, you have to learn the anatomy of the vein of the lower limb also. Okay? So today, let's learn about the venous drainage of the lower limb. The main vein is the great saphenous vein that is responsible for the superficial drainage of the venous blood of the inferior extremity. Do you know what is meant by Saphenous? Yes, it is a Greek word. Its meaning is easily seen. Yes, the great saphenous vein that lies on the superficial fascia, and so it is easily seen under the skin. So it is termed as the saphenous. Another vein that is named as the small saphenous vein also present, and we will also learn about the small saphenous vein. Another name of the great saphenous vein is the long saphenous vein. It is the longest vein of the body, okay, and have numerous valves which allow the blood to flow towards the heart. Okay, let's see the course of the great saphenous vein. We will draw the superficial venous drainage of the lower limb, and for that we have to draw two boxes. Here is one, and in this box we will draw the course of the small saphenous vein. Okay, here we will draw the ankle. Here is the medial side, great to here. From here we will go in front, and then the patella, thigh. Here is the calf, knee joint. Here is the leg. Bold the lines. Here. Okay. Here we will draw the medial malleolus, the bony prominence. Okay. Now, the great saphenous vein that will arise from the medial end of the dorsal venous arch along with the medial marginal vein. It is the medial marginal vein, this one, and go up, and in the ankle it will ascend upward in between the bony prominence, that is the medial malleolus, and here another tendon will present, the tendon of the tibialis anterior muscle. In between these two, the great saphenous vein will go up. Then it will go to the medial aspect of the lower surface, medial surface of the tibia, and that is subcutaneous. And during this course, it will accompanied by the saphenous nerve. Then it will ascend upward along the medial border of the tibia and goes backward in the back side of the knee. Okay, if this is a patella, in the knee this vein will situated 1 hand's breadth behind the patella. Okay, then this vein will go upward again along the medial aspect of the thigh and run like this till it end in the saphenous opening of the fascia lata. Here is the saphenous opening of the fascia lata, this one. Okay, and it is the great saphenous vein, the vein that is easily seen, the longest vein. Okay, during its course, I have already said that here in this portion in the lower third, it is accompanied by the saphenous nerve. In the thigh, here it is accompanied by the medial cutaneous nerve of the thigh. And here in the saphenous opening, it pairs the cribriform plate and will drain into the femoral vein. But before draining, it pierces the anterior wall of the femoral sheath. And that saphenofemoral opening is guarded by a valve that is situated 3.5 to 4 cm inferolateral to the pubic tubercle. Before piercing the cribriform plate, it will receive the branches or tributaries like superficial external iliac vein from this region, superficial superior epigastric vein from this region, the superficial external pudendal vein. Another tributaries of the great saphenous vein are below the knee, here the posterior arch vein, this one posterior arch vein, and the arc of veins which connect the perforators. Here is one perforator, here is another perforator, here is another perforator. There are 3 perforators here. These are the medial ankle perforators. Okay, and these perforators will connect the superficial veins with the deep veins, and they have also the valve. Okay, look at here. If I zoom this portion, then it is the posterior arch vein. Okay, and here is the great saphenous vein. From here there are 3 perforators. Here is one perforator, here is another one, and here is another one. These perforators will connect this posterior arch vein with the tibial vein, that is the deep vein. One of the deep veins is tibial vein. Okay, and these are the medial ankle perforators. Don't think this rounded structure as the perforator. This fruit like rounded one is not the perforator. Okay, these are the perforators. Here is one perforator, here is one perforator, here is another perforator. But why I have drawn this circular structure here? Because if I don't draw this, then this will seems as the superficial vein, the other 3 sub branch of this posterior arch vein. Okay, but when I make this circle, I mean it will go into the deep. Okay, it will go deep to connect with the deep veins. Okay, another vein is anterior leg vein here. Now in this region, here is another perforator, that is the knee perforator, and here is another perforator, that is the adductor canal perforator. Okay, here is another vein, that is the anterolateral vein that drains the anterolateral portion of the thigh, and here is another vein, that is the posterior medial vein, which drains the posterior medial portion of the thigh. Clear? And during perforation of the cribriform plate, the great saphenous vein will accompany it with the superficial branches of the femoral arteries. Those are the superficial external iliac artery, superficial superior epigastric artery, superficial external pudendal artery. Those arteries also pierce the cribriform plate along with the great saphenous vein, and there are few lymphatics also pierce the cribriform plate. Now come to the small saphenous vein. So before drawing the small saphenous vein, we have to draw another leg. The small saphenous vein will arise from the lateral end of the dorsal venous arch. We cannot see the dorsal venous arch here because it is the plantar aspect or plantar surface of the foot. Okay? And it will unite with the lateral marginal vein. All this thing will happen on the dorsal surface. Then it will ascend upward behind the lateral malleolus. Okay. Then it runs along the lateral aspect of the tendocalcaneus, that tendon. Then middle aspect of the calf muscle. Okay. This is the region of the knee joint. Here it will pierce the deep fascia and it will drain into the popliteal vein just above the level of the knee joint. Okay. But there are some variation in this drainage. That is, this small saphenous vein will may bifurcate, and then one portion drain in this vein and another portion will go into the anterior aspect of the thigh and drain directly into the great saphenous vein, or this small saphenous vein will bypass the popliteal vein and go in front of the thigh and drain into the great saphenous vein. But usually it drains into the popliteal vein. Clear? Here we will learn about another perforator, that is the lateral ankle perforator. Here, this is the lateral ankle perforator. So we have seen the 4 perforators. Here it is the medial ankle perforator, 3 medial ankle perforators, 1 knee perforator, another adductor canal perforator, and here is the lateral ankle perforator. Okay. Here also same thing occur. With this rounded circle, it is meant in the book that this perforator will go deep to connect with the deep vein. Clear? And the deep vein correspond the arteries, that is the femoral artery, popliteal artery, tibial artery, anterotibial, posterior artery. Okay. Then the plantar arteries. The vein will accompany these arteries, and name are same, just you have to put a word vein at the end of that name. That is the medial plantar vein, lateral plantar vein, tibial vein, etc. But below the popliteal artery, the veins are situated in a special manner, and that is remain as the veni comittentis. What is veni comittentis? It is the artery, one artery, and accompany 2 veins on each side of the artery. This type of arrangement is termed as the veni comittentis. So below the popliteal vein, tibial artery is guarded on each side by the 2 tibial veins. Plantar arteries are guarded on both sides by the plantar veins, 2 plantar veins. There is 1 medial plantar artery but 2 medial plantar veins. There will be 1 lateral plantar artery but on each side 2 lateral plantar vein. Okay, 1 posterior tibial artery, on each side there will be 2 posterior tibial veins. Clear? But in case of popliteal vein, these are not present in pair. Femoral vein, not pair. Here they are single. Okay, 1 popliteal artery, 1 popliteal vein, 1 femoral artery, 1 femoral vein. Okay, 1 external iliac artery, 1 external iliac vein. Clear? And you are thinking that then how these 2 veins will drain in 1 popliteal vein? Okay, popliteal vein is single and these 2 will go there and drain at that vein. Okay, I hope from now you can easily tell the superficial venous drainage, and you have also known the perforators and the veni comittentis. And now I want to show you the direction of the valves. Suppose this one is the superficial vein here, and it is draining into the deep vein. This one is the deep vein, it is larger one. Okay, valves are situated like this. The superficial veins also possess valve like this, And the deep veins also possess valves here, and its direction is towards the heart because it allow the blood to flow toward the heart. Okay, that means in that direction. Okay, and what is the function of this valve? When the blood wants to come back, the valve will close and causes the segmentation of the vein. So ultimately, load of the blood is reduced in a large vessel, isn't it? It will be helpful for better venous drainage. Again, that if there is no valve present in the vein, so what will happen? The total channel is full of blood, and when from the below side or factors that help in returning the blood towards the heart, they act, some very few amount of blood will go up, and then all of the blood will come down. Okay, when they stop their action, because one muscle does not contract all the time. It will contract, then relax, then contract, then relax, isn't it? One artery does not always pulse. It is pulse, then stop, then again pulse, again stop, isn't it? So during this relaxation of the muscle, during the stopping of the pulse for few milliseconds, that time all the blood will come back again, and the venous stasis will occur in the leg, or varicose vein always occur in the leg, isn't it? So it actually causes the segmentation of the large vessel and help in better venous drainage. There are some other factors. Those are the action of the surrounding muscles, and in some muscle there are some venous sinuses also, like the soleus. So when soleus contract, the belly of the soleus contract, the blood remain in the soleus muscle, will go up through the deep vein towards the heart, isn't it? And then when it relax, then the sinus will fill with blood again. Okay. Another factor is the presence of this vena committantis. Here, these arteries are pulsatile. We know that there are two veins situated on each side of the artery. Okay, so when the artery give one pulse, it will push the vein to move their blood upward, isn't it? Here it gives the pulse, some blood will go upward, again. Okay, so when varicosity develop, varicosity will develop when the valve become incompetence. Here the wall of the vessel will become weaker, then this valve cannot prevent the backward flowing of the blood, then some blood will come back again. This valve also incompetent, here not working, then it will come back again. Then this vein, superficial vein, will be dilated. Why? This vein is carrying blood from the capillary, isn't it? And in the capillary, the blood come from the arterial circulation, isn't it? So when heart pump, it will pull the blood up to the capillary through the arteries, isn't it? And it will come back again through the veins. Okay, so when the valve become incompetence, does the heart stop its action? No, it is continuously beating. It is pulling the blood from the heart up to the capillary, from the heart up to the capillary. So from the capillary, blood is accumulating here. In normal time, it will go up to the heart and the backflow is permitted by the valve. So only the blood coming from the capillary is present in the vein, superficial vein. But here in the incompetence, blood coming from the capillary is present, and blood that is coming from the backflow due to incompetence of the valve is also accumulating here. So this vein have to enlarge its diameter, isn't it? Okay, like this. And when more blood will accumulate, then it will become tortuous, because we have to give space to more thing by making it tortuous, isn't it? For this reason, this abnormal dilatation occur and varicosity of the superficial vein occur. I hope it is clear to you now. And we have talked about the venesection. The term venesection, it is usually performed here, where the vein is subcutaneous. Okay,